Why should the government keep on lying to Kenyans that the universal health coverage is working for all Kenyans? This is because the day before yesterday, so there was this kid who was in Mater Hospital and ended up passing on. So the news we were told, the parents narrated it very clearly.
Lakini mara mbili tumeenda wakatuambia ya kwamba saizi SHA ina support public servants peke yao for overseas treatment.
An 8-week-old boy, I beg your pardon, admitted at Mater Hospital says it has been locked out of the benefits package on account of them not being public servants.
So there's an overseas treatment package that enables you, if you are registered in SHA, to be able to receive treatment outside Kenya, for instance, if you are sick, especially those people who go to India and places like that to seek treatment because there are some services that is not available in Kenya. So you end up going overseas, either in the US, the UK, India. Now, we come to realize that this package is only available for civil servants. Can you believe it? So this family goes ahead, their 8-week-old son is sick, and they go ahead to SHA offices and they are told that the overseas package is only available currently to civil servants. Listen.
Lakini mara mbili tumeenda wakatuambia ya kwamba saizi SHA ina support public servants peke yao for overseas treatment.
So how do you tell Kenyans that universal health coverage is for everyone, yet when they go to the hospitals, they are told, no, this is only available for civil servants, particularly the overseas treatment package? How do you have a system that's worth 104 billion and yet people cannot be able to access treatment if they go overseas? And the only people who can afford it are civil servants. And yet, your CEO is saying this service is available for all Kenyans as long as you are a member of SHA.
The Social Health Authority says the process of empanelling foreign healthcare providers is still ongoing, but assures that the benefit for registered members remain at 500,000 shillings.
Now, this is a complete lie because now there's a family that has just lost a son. It's very, very heartbreaking. The president is going around in Western Kenya telling people to register that the government will take care of everything. Listen.
Taki mwananchi aende hospitali tena, atibiwe, atinauze mali yake ili aweze kulipa matibabu. Matibabu yote italipwa sasa na serikali ya Kenya kupitia bima ya afya na support ya serikali ya Kenya. Ndio tukasema tunaweka bima mpya ambayo itashughulikia Wakenya wote. Yule ako na kazi, yule hana kazi, yule ako na uwezo, yule hana uwezo, kila mmoja wetu utapata bima ya afya. Wenye uwezo watalipa. Nyinyi ambao hamuna uwezo tutawalipia kama serikali ya Kenya.
Why should the government lie to Kenyans that it will take care of everything, yet when you go to the hospital and you want your loved one to go overseas to seek treatment, you're being told you guys are not civil servants. If you're not civil servants, then you can't get the 500,000 Kenya shillings that is available for this overseas treatment package. How is this fair? Because every month, Kenyans are being deducted a huge amount from their salaries. Every month without fail. But when you go to seek treatment for your loved one, for your child, you are told that you are not a civil servant and hence this international treatment package cannot be given to you and your loved one ends up dying. Can you imagine that?
Just receiving that the 8-week-old boy who was admitted at Mater Hospital and whose family was unable to access the overseas treatment package stipulated in the universal health coverage on account of them not being public servants has passed on our condolences.
This is what I'm saying. The president is going around and I'm not stopping him from going around. Go around. My problem is the CEO and everyone who was involved in the development of SHA. Didn't they know that there are people who usually go overseas to seek treatment? Because this is something that has been happening. We know that when people are sick, people go to India. So why didn't the government plan effectively for this? Because they know all Kenyans eventually will need to use this service at one point. So when a Kenyan, and this is just one event that has been brought to our attention, how about the people who have actually lost their loved ones and they have not come forward to speak about it? What about the people who have not come forward to explain and to tell us this is what we went through? I'm sure this is just a reflection of just a few people in the country and they are having a lot of problems just accessing services that the government is promising exists and it doesn't. You tell me how many Kenyans are going to die before we realize that this system needs to be overhauled. How many times have we seen cases where the money is going through, but people can't get the service. 104 billion Kenya shillings. You couldn't even put some money aside for emergency cases like these when people cannot access these services. Instead of letting them die, why don't we have a system that someone can actually access this service even if it needs approval from the cabinet secretary? And I haven't seen the Ministry of Health or the cabinet secretary talk about this. It's actually very unfortunate that we Kenyans are being pushed into this system that is causing so many of us to die since October last year. And we are still pushing it, telling people that the government will pay for everything. But when you go on the ground, you look at what the people are going through. You see this young family that has lost a son, an 8-week-old. This family will never be the same again. This kid will never come back because of a system that is not working.
Sasa msisikie tu maneno ya mitandaoni, endeni kwa mahospitali mujione kama watu wanatibiwa au la.
Guys, we need to stop being played. Because yes, the president is really working so hard to tell us all these things, good things about this system, that all we need is just register. We don't need to do anything else.
Yule ako na kazi, yule hana kazi, yule ako na uwezo, yule hana uwezo, kila mmoja wetu utapata bima ya afya. Wenye uwezo watalipa. Nyinyi ambao hamuna uwezo tutawalipia kama serikali ya Kenya. Matibabu yote italipwa sasa na serikali ya Kenya kupitia bima ya afya na support ya serikali ya Kenya.
So the president is telling us, don't do anything else. Everything is good. But when you go on the ground, people are dying. Ask yourself,